So providers may think that they are adequately protecting their identities, but what kind of actions or behaviors could inadvertently put them at risk?
I think there's a number of things that we can do from a prevention standpoint to better safeguard our identities. And unfortunately, as I work clinically, I've seen where we are not taking all of the preventive measures that we could be. One, I think, very common thing that I've seen is using identity shortcuts. So things like stamps that physicians can use to sign off on documentation. The stamp could include not only their signature, but also information about their identity, like the NPI, the DEA number, etc. So I think being very careful about the use of those convenience items, either deciding not to use them at all or treating them very carefully and securing them when using those items is really important. In the same way, not leaving around certain documentation like prescription pads to make sure that they can't be stolen, misappropriated in some way. I think we can also, just as a community, be smarter about not releasing our medical information or identities as often as perhaps we do. So, being very careful about what documents a physician signs is really important because you never know who might be on the receiving end of that document. Being careful where EHR records are sent is another example. So it is a matter of just being very thoughtful, treating those identities with great care and not releasing them because unfortunately there are unscrupulous entities on the other end that could misappropriate them.
So then what do you see the challenges are from the payer perspective for medical identity theft?
Yeah, that's really important. I think there's clearly a lot that we've discussed that individual providers can do from a prevention standpoint on this issue. But I have to say, very central to being a payer, and it doesn't matter if it's in Medicare or in one of the private plans or in Medicare Advantage or Part D, information sharing is central to the payer relationship. We have to be able to receive claims from various billing companies, be able to exchange information with individual providers, institutional providers. There's a whole set of complex relationships that are part of the healthcare payment environment. That kind of data exchange can present risks for identity theft because identities are contained in numerous different IT systems across numerous different organizations. And so, the information exchange, while extremely vital, can be a source of issues for identity theft and kind of necessitates that payers and providers work together to safeguard the information, make sure IT systems are secure, make sure people are trained in the use of that information and don't release identifiers where they shouldn't.
It is important for the special investigative units to help protect doctors in their network by detecting identity theft early when it does happen. What red flags and claims data indicate potentially fraudulent use of physicians or other providers' identifiers?
Yeah, so here claims analytics can be a real help in stemming this issue, and both public and private payers do engage in the relevant analytics. We look for unusual trends or patterns that are suggestive of identity theft, things like new services being offered that the provider doesn't have a track record in providing before, or services being offered that just don't make sense for a geographic area, services that are offered too far away from where the provider has historically been working, or even new practice locations being opened or created. These are the kinds of signs that to us can be suggestive of identity theft and allow us to then engage in more investigative work to really figure out if theft has occurred. I think beyond the claims analytics, which are clearly important, we also want to engage the provider and collaborate with providers as a real way of addressing this issue. And so getting providers to monitor their own services or reporting potential issues to payers can be extremely helpful as well.
Plan sponsors and providers both share responsibility to prevent against medical identity theft. And so can you share some of the sort of proactive steps or best practices that providers and plan sponsors could be taking?
Yeah, that's a great question. So we've talked a little bit about, maybe from a provider standpoint, being more preventive on the front end. So number one, being aware of the issue generally. Two, implementing countermeasures. So being very careful about convenience items, as we discussed, being very careful about IT security, securing identifiers wherever possible, training up staff to make sure that they are aware of the issue. All of those measures can be very helpful. I think third, from a provider perspective, is being aware of your own billing. So every once in a while checking, billing as it goes to public and private payers to ensure that all those bills are and claims are appropriate. Checking enrollment records to make sure that there are no new practice locations or locations that you can't recognize associated with your billing information is very important. From a payer perspective, whether again it's public or private, I think we certainly have the obligation to be very well aware of these issues, to perform the necessary analytics, to collaborate with physicians and other providers to make sure that all of us are being as preventive as possible, or where the unfortunate situation has occurred and identity theft has already taken place, trying to ameliorate that and return the identity to the physician is very important. On our side, we also have to take things like IT security very seriously so that we are not leaving potential vulnerabilities open.
How do you see recent changes to Medicare provider enrollment requirements impacting provider identity theft?
Medicare provider enrollment has been a really important set of measures for CMS generally, and then I think extending out to the private payers as well. It affords us the opportunity to verify information about a provider's background, including medical licensure information, medical education information, and then making sure that we track those things over time and revalidate them periodically. We have, I think as a result, encountered actually medical identity theft or the outcomes more than we were aware of before, but have also been able to then implement process changes to intervene in this issue much earlier. So for example, we've been able to implement process changes around clinical location setting to make sure that when new clinical locations come in, we actually communicate very early and proactively with the provider to ensure that it's an appropriate clinical location that they intended to associate with their enrollment record. That's just one example of the kind of multiple different areas that provider enrollment has really worked to have an impact on this issue.